Biggest benefits I can see from both sides of the coin, from the management side and the staff side, is that using the devices out in the field is going to save a lot of time for the staff, and also a lot of hassle for the service users as well. They're currently having to sign all their timesheets, they're having to sign the communication sheets, which can be quite difficult for a lot of our service users because they need help for a reason. On the management side of things, there's going to be a lot less time spent on producing timesheets, changing timesheets, getting those out to the staff, getting them to come in to pick them up. With the PS Health system, it's automatically downloaded onto the device. Changes go through more or less straight away within 15 minutes, so they have any changes there instantly. So the impact on the coordinating side of things is going to be quite huge. But also when the staff are out there, they have more time to interact with the service users as well. Like I said, rather than getting them to sign this, sign that, which takes probably a good 5 minutes to sign all of their paperwork, they can just go in, scan their device, get on with the visit. Same with coming out again. The care workers have taken to working with the devices really quite well. No one likes change, that's more than apparent in anything. But we did a pilot with a few members of staff. They fed back to the other members of staff how positive it was and how easy it was to use. And once they've started using the devices, I think they've realised that as well. So it's less hassle than carrying timesheets about, less hassle than carrying service user notes about, because it's going to be all on the device, which is also security PIN coded as well. So there's confidentiality, safety aspects of the device as well, which is going to have a positive impact on the users and the staff. But they've really welcomed it, and I think it's going to be a good move forward once we get onto the devices completely. Okay, looking at the service user safety side of things, at the moment we currently use the good old-fashioned pen and paper for the scheduled visits, which is something that's been the same since 1998. Now, with the devices all up and running, we can actually track the visits on the system. So what is actually going on out there in the field, we can see in the office live as it's happening. If a service user doesn't receive their visit, or it's a late visit, it will be flagged up straight away, so we can contact the member of staff, see what's happened. It could be that they've had an accident or they've been held up, but we can actually track the calls as they go on. So if anything is missed or late, we know about it immediately, rather than waiting for someone to pick up the phone and say, I haven't had my call yet, what's going on? And that's if they can pick up the phone and let us know that something is happening. So knowing what's going on out there in the field as it happens, or as it doesn't happen, is paramount to delivering a high quality service from our point of view.